Odontogenic cysts. A cyst is a pathological cavity in the hard and soft tissues filled with fluid, semi-fluid or gas, not always lined by epithelium and surrounded by a definite connective tissue wall. Cysts occur in jaws than in other bones because cysts originate from numerous rests of odontogenic epithelium that remain after tooth formation. Classification of odontogenic cysts. It can be classified as developmental cyst as well as inflammatory cyst. Under developmental cyst comes primordial cyst, keratocyst, gingival cyst of the infant, gingival cyst of the adult, lateral periodontal cyst, dentigerous cyst, eruption cyst, calcifying epithelial odontogenic cyst, botryoid cyst, etc. Inflammatory cysts are periodontal cyst, radicular cyst, lateral cyst, residual cyst, and paradental cyst. Non-odontogenic cysts are nasopalatine cyst, median cyst, median alveolar cyst, median mandibular cyst, globulomaxillary cyst, nasoalveolar cyst, and palatal cyst of newborns. Then you have cysts associated with maxillary sinus also, like benign mucosal cyst of the maxillary sinus, mucocele, serous cyst, cyst of McGregor, lymphangiectatic cyst, surgical ciliated cyst of maxilla. Then cyst of the soft tissues of face and neck, the dermoid cyst, epidermoid cyst, branchial cleft cyst, thyroglossal cyst, anterior median lingual cyst, oral cyst with gastric or intestinal epithelium, cystic hygroma, parasitic cyst, cyst of salivary glands, mucocele, mucus retention cyst, mucus extravasation cyst, ranula. Pseudocysts are static bone cyst, simple bone cyst, idiopathic bone cyst, aneurysmal bone cyst. I'm going into odontogenic cyst. In that, developmental cyst. First one is primordial cyst. Site of occurrence is ascending ramus of the mandible and third molar area. Age group associated are children and young adults. Histopathologic features are epithelial cells in picket fence or tombstone pattern. Radiographic features, it appears as a unilocular, well-defined radiolucency with scalloped outline. Borders are hyperostotic, involved tooth will be missing, and adjacent teeth displaced. Differential diagnoses are odontogenic keratocyst, residual cyst, traumatic bone cyst. Treatment, surgical enucleation with regular checkup, and it has got a high recurrence rate. This is the diagrammatic representation showing primordial cyst. Now, next one is odontogenic keratocyst. Site is mandible near the angle and mandibular third molar and maxillary and mandibular canine region. Age group usually affected are young adults, mainly males. Radiographic feature, aggressive growth with undulating borders, internal septa giving multilocular appearance. Borders are hyperostotic, minimal expansion and perforate lingual and buccal cortical plates and involve soft tissue. Adjacent teeth will be displaced, downward displacement of the mandibular canal, resorption of lower cortical plate. This is the radiograph showing odontogenic keratocyst. Radiological types are envelopmental type, which embraces an unerupted tooth, replacement type in place of a normal tooth, extraneous type in ascending ramus, collateral type adjacent to roots of teeth. CT shows minimally expanding lesion with thick sclerotic margin and cloudy lumen. Syndrome associated with multiple odontogenic keratocysts are Gorlin-Gold syndrome, Marfan syndrome, Ehlers-Danlos syndrome, and Noonan syndrome. Differential diagnoses are dentigerous cyst, aminoblastoma, residual cyst, traumatic bone cyst, etc. Treatment, surgical enucleation and vigorous curettage with regular checkup. High recurrence rate is there. Gorlin-Gold syndrome, it is an inherited disorder consisting of multiple nevoid basal cell carcinoma of the skin, skeletal lesion like rib anomalies, bifidrint, polydactyly, shortening of metacarpals, CNS abnormality like mental retardation, calcification of fox cerebri, agenesis of corpus callosum. Eye abnormality like hypertelorism with wide nasal bridge, congenital blindness. Multiple josses will be present. Gorlin-Gold syndrome radiographic feature appears as multiple radiolucencies of variable size in multiple quadrants, commonly in premolar molar region, radiopaque lines in Fox cerebri. Differential diagnosis are multiple myeloma, histiocytosis, cherubism. Treatment is surgical enucleation and vigorous curettage with regular checkup, and there is a high recurrence rate. Lateral periodontal cyst. Inflammatory or developmental. Inflammatory near the alveolar crest from cell rest of molasses. Developmental associated with developing tooth germ. Site, lateral surface of vital teeth, mandibular canine, premolar region. Age group, adults between 22 to 85 years, and there is a male predilection. Radiographic feature, unilocular radiolucency, which is well defined and located between the cervical margin and apex of root surface, less than 1 centimeter in diameter, and the borders will be hyperostotic. Adjacent teeth will be displaced. Differential diagnoses are lateral radicular cyst, residual cyst, and lateral dentigerous cyst. Treatment is surgical enucleation. This is the radiograph showing lateral periodontal cyst. Gingival cyst of the adult. Site is free or attached gingiva from remnants of dental lamina, mandibular canine, and premolar region are usually affected. Age group is adults in 5th or 6th decade. Clinical features, it appears as smooth bluish red when filled with blood due to trauma. Radiographic features, no changes, may cause superficial bone erosion. Treatment is surgical enucleation. Botryoid odontogenic cyst is multilocular periodontal cyst, which has got a high recurrence rate. Glandular odontogenic cyst, which can occur in either jaws. Age group, wide age range. Radiographic feature appears as a unilocular or multilocular radiolucency with smooth or scalloped margins. Treatment is surgical enucleation. Dental lamina cyst, site is in the line of fusion occurring as Epstein pearls, which are keratin-filled cysts along the line of fusion. Bones nodules, the junction of hard and soft palate. Dental lamina cyst, crust of maxillary and mandibular ridges. Age before the 3 months of age. Clinical features appears as small whitish projections 2 to 3 millimeters on the alveolar ridge of jaws of infants. Treatment, disappear by opening onto the surface mucosa or with erupting teeth. Dentigerous cyst forms around the crown of unerupted tooth, begins when fluid accumulates in the layers of reduced enamel epithelium or to cystic changes of enamel organ after formation of crown. Clinical features, second most common cyst, is symptomatic and discovered on routine radiographs. Site is mandibular third molar and maxillary canine region, enclosing supernumerary tooth. Age group, children and young adults are affected. Radiographic feature, it's seen as a unilocular, well-defined radiolucency associated with crown of unerupted teeth. Borders are hyperostotic, may be multilocular, and adjacent teeth will be displaced. According to Thomas, there are 3 types: central variety, lateral, and circumferential type. Central type, here crown is enveloped symmetrically, tooth pushed away from the direction of eruption. Lateral type, dilation of follicle on one aspect of crown, mostly impacted molar is partially erupted. Circumferential type, entire tooth appears to be enveloped by cyst, may allow the tooth to erupt through the cyst as through hole in the donut. According to Morshak, it can be classified as class 1 and class 2. Class 1 is associated with unerupted teeth and class 2 is associated with partially erupted teeth. This is the radiograph showing dentigerous cyst. It's an OPG showing dentigerous cyst. Reverse Townes projection is ideal to depict cystic expansion of ascending ramus. CT examination aids in delineating the extent of malignant lesion and discloses the invasion of adjacent anatomic regions. Differential diagnosis, ameloblastoma and adenoblastic fibroma, adenomatoid odontogenic tumor, calcifying odontogenic cyst, odontogenic keratosis. Treatment is surgical enucleation. Next is eruption cyst, which is a form of dentigerous cyst associated with erupting deciduous or permanent teeth. The tooth is embedded in its eruption within soft tissue overlying bone. Clinical features seen as circumscribed, fluctuant, translucent swelling of alveolar ridge. When cystic cavity contains blood, it is called eruption hematoma. Radiographic feature, expansion of normal follicular space of erupting tooth. Say radiograph showing eruption cyst. Next one is calcifying epithelial odontogenic cyst or CEOC. Site is anterior to first molar area affecting both jaws. Adults 10 to 19 years, mostly females, are affected. Clinical features, it appears as a painless, causes expansion and destruction of the cortical plates. Radiographic feature, unilocular or multilocular, well-defined radiolucency with cortical plate perforation. Involved tooth will be missing. Adjacent teeth displaced or resorbed. May be associated with unerupted tooth. The radiolucency may contain small foci of calcified material as white flecks or radiopacities. So this is the radiograph showing calcifying epithelial odontogenic cyst. In CT, by widening the window settings, keratin and calcifications can be identified. Differential diagnosis is fibrous dysplasia, AOT, ossifying fibroma, ameloblastic fibro-odontoma, cementoblastoma, and calcifying odontogenic tumor. Treatment is surgical enucleation with curettage. Radicular cyst. Clinical features, most common cyst, non-tender expansion of cortical bone. Crepitations may be present. If bone thin and resorbed, it will be fluctuant. Site is maxillary anterior teeth, more common, non-vital teeth. Age group is 3rd to 6th decade of life. Radiographic features seen as a round or pear-shaped, well-defined radiolucency located at apex of non-vital tooth, usually more than 1.5 centimeter, and the borders will be hyperostotic. The involved tooth will be non-vital. Radiopaque border continues with lamina dura of associated teeth. In case of infection, border becomes indistinct. Deciduous molars may be positioned buccal with the tooth. Root resorption may be seen and adjacent teeth will be displaced. So this is the diagrammatic presentation showing radicular cyst. This is the radiographic image showing radicular cyst. Differential diagnosis, periapical granuloma less than 1.5 centimeter, periapical scar, periapical cementoma, traumatic bone cyst, mandibular infected buccal cyst, OKC. Treatment is RCT, apical surgery, extraction, surgical enucleation or marsupialization. Next one is residual cyst, remains after incomplete removal of an original cyst, remained after tooth was extracted, formed from epithelial cell rest from periodontal ligament of lost tooth. Clinical features, most common cyst, non-tender expansion of cortical bone, crepitations may be present. If bone thinned and resorbed, it will be fluctuant. Site is maxilla, tooth-bearing region. Seen in older patients, males are usually seen. Radiographic feature, round or pear-shaped, well-defined radiolucency with thin radiopaque border. In case of infection, border becomes indistinct. Root resorption may be seen, adjacent teeth will be displaced. Differential diagnosis, primordial cyst, traumatic bone cyst, ameloblastoma, OKC. Treatment is surgical enucleation or marsupialization. This is a radiograph showing residual cyst. Next one is buccal bifurcation cyst formed from epithelial cell rest from the periodontal ligament of buccal bifurcation of mandibular molars. Clinical features, hard swelling, buccal to mandibular molars, delay in eruption of mandibular first or second molar, lingual cusp abnormally protruding higher position than buccal cusp, site is buccal bifurcation of first mandibular molars, followed by second molar, age group is first 2 decades. Radiographic features, seen as round, well-defined radiolucency with thin cortical borders superimposed over the images of roots of molars. Lamina dura will be intact. Tipping of roots of molars into the lingual cortical plate and occlusal aspect towards buccal. In case of infection, border becomes indistinct. Cross-sectional mandibular occlusal view is more preferred. Root resorption may be seen. Adjacent teeth displaced. Differential diagnosis: periodontal abscess, dentiger assist. Treatment: conservative curettage, extraction. Paradental cyst: inflammatory cyst occurring in the lateral aspect of third molar with history of pericoronitis. Site is third molar on buccal surface. Age group third decade. Males are mostly affected. Radiographic feature usually seen as a unilocular, well-defined radiolucency distant to partially erupted tooth with buccal superimposition. Differential diagnosis: periodontal abscess, dentiger assist. Treatment is surgical enucleation.